Cardiovascular system. This is number 3 in the series of lectures for the cardiovascular system, treatment of coronary artery disease and pulmonary circulation. Topics include the diagnosis, treatment of coronary disease, and some of the pulmonary circulation. And we're going to begin with reviewing how the coronary arteries are getting oxygenated blood. And this is a depiction of the aortic arch. So it's cut away at the top. We're looking down from above, and you're seeing the 3 aortic cusps, and they're closed. So this is in diastole. And when they're closed, there's a backflow of blood from the aorta, and it's filling up the coronary arteries, the left and right main coronary arteries. And you can see the aortic valve, as it's closed, is filling the right coronary artery and the left. And doing cardiac catheterization, the cardiologist can insert a catheter up into the aorta, go down into either one of those main arteries, inject dye, and see if there's coronary disease and exactly where the coronary artery disease is. And if you can notice by this image, the left main coronary artery that comes off has supplies the majority of the heart, particularly the septum, and it also, feeds the majority of this left ventricle that gives you the main pump. So without your left main coronary artery, you completely lose blood pressure. And that's why a lesion within that left main system is called a Widowmaker. This is the first question. You're seeing the cardiac catheterization, injecting dye into one of the coronary arteries and looking at any disease that's within those arteries. So quick review question, is this being injected into the left or the right main coronary artery? The answer is the left main. Look at it, how it looks like it's nearly showing you the entire heart, because the left main coronary artery contributes most of the coronary circulation. This is an anterior view, so looking at the heart as it's lying in the chest, showing the what you're looking at is actually the right ventricle here, and showing the left main coronary artery coming down, turning quickly into the LAD, or the left anterior descending. It feeds the ventricular system, and that's where the cardiac conduction system is for the left and right bundle branches, excuse me. This is another image of the heart looking down from above. Notice anterior is above in this image. The thicker cardiac structure is the aorta, and off to the right of it is showed the superior vena cava, and you can see the coronary arteries coming off of the base of the aorta. Next question. This is a cadaver heart. This is a superior view, an anterior superior view of the heart. And so getting your bearings, this thicker walled, this is the aorta. You can also tell it's the aorta because it's having coronary arteries coming off of it. And this artery right here is the pulmonary artery. So is the white arrow the left main coronary artery or the right main coronary artery? That's the right main coronary artery. So it's really huge. If you have plaque in your coronary arteries, the cardiologists, when they find the area, they can place a stent, or they can dilate it. If they dilate it, it's called an angioplasty. Otherwise, they can also put a balloon through there and deploy what's called a stent that keeps that plaque area open. The other option for treatment of cardiovascular disease is coronary artery bypass. This would be in the operating room. So the patient would be under general anesthesia, so it's significantly more invasive compared to a stent placement. There's a couple types of bypasses. One with a vein. So the saphenous vein is a very common vein taken out of the leg. And since you have so many more veins than arteries, you will have plenty of vein in your leg to take care of venous return. So that's the saphenous vein showing a bypass. And then the other option is taking the internal mammary artery and swinging it over and using it as a bypass grafting. Okay, another question. Notice that plaque is developing the walls of arteries. Don't do a vein bypass. So why don't veins need bypass grafting? Option A, there is less turbulent blood flow in veins, or B, there's more turbulent blood flow in veins. The answer is there's a lot more turbulent blood flow. And the other thing is that there are a lot more veins than arteries. So if you shut down a vein, they can find alternative routes to get back to the heart. So this is a depiction showing how there's so much more pressure on arteries. They have thicker walls, and their endothelium is much more likely to get torn and disrupted. So they develop plaque. So this upper part is showing the systolic blood pressure as it's coming out of the aorta. Bottom is the diastolic pressure. And then as it comes down, the pressure reduces until finally it's down in the capillaries. It's fairly low. And then there's a little bit of pressure in veins as it's returning. So veins require valves in order to not have any flow backwards. So looking at the veins of the heart, there is one important vein to need to know, the coronary sinus. And it collects all the deoxygenated blood that's coming from the heart, and that it turns around and dumps that into the right atrium. Since it's deoxygenated blood, you don't want it to mix with your already oxygenated blood in the left atrium, so it gets dumped into the right atrium. So that blood gets mixed with other deoxygenated blood that eventually gets pumped from the right ventricle into the pulmonary artery and into the lungs for oxygenation. So the coronary circulation summary: arteries provide the oxygenated blood to the heart muscle, also called the myocardium. The veins are taking that deoxygenated blood back to the left atrium. Excuse me, that's so totally wrong. It's taking deoxygenated blood back to the right atrium. I will fix that for in your PDF. So this is showing the numbers: ascending artery, ascending aorta, coronary arteries, the coronary sinus, and the right atrium. And this says it correctly. Deoxygenated blood to right atrium. So the next topic is pulmonary circulation. First question in pulmonary circulation. A vessel can refer to an artery or a vein. True or false? Answer is true. A vessel is just a general term. It can refer to anything from lymphatics to veins or arteries, venules, capillaries. All of those things are vessels. Basically, just a transport system. The capillaries are the only part of all that transport system that you start having the business side, where you're having nutrient transfer and oxygen and gas exchange. And of course, the lymphatics have vessels too that we'll get into when we get into the immune system. So arteries pump blood away from the heart, so they have more smooth muscle. They're thicker walled. Veins toward the pump. So veins are a low pressure system. They have to have valves, and they're significantly more numerous than arteries. And of course, capillaries are that single layer thick. So within the lungs, there's a capillary network that surrounds the alveoli. Very low pressure system, that thin tissue between the capillaries and the alveoli. Okay, next question. Is the arrow pointing to the pulmonary artery or the pulmonary vein? Look at the direction of blood flow. This is showing deoxygenated blood going out of the right ventricle. And so that's the going away from the heart, even though it's the right side of the heart, is pulmonary artery. So colors only depict oxygenation and deoxygenation. So red is oxygenated, blue is deoxygenated. And although it's deoxygenated, it's still an artery since it's coming away from the pump. So this is a simplified version, just showing mainly the direction of blood flow. Is a green arrow pointing to an artery or a vein? Just to recap there, artery, pulmonary artery. Okay, how about this one? Is the green arrow pointing to an artery or a vein? Notice the direction of the arrow, blood flow back to the heart. So even though it's oxygenated blood, it's a vein because it's going towards the heart. So after delivery, you have shunts closing, and the heart turns into this double pump. So remember, any vessel leaving the heart is an artery. It can carry oxygenated or deoxygenated blood, and they're thicker than veins. So I'm going to take you to just one patient example. This is when I was teaching in Ethiopia, the Black Lion Hospital. The presentation is a little 12-year-old boy who was having severe respiratory distress. His respiratory rate was 35 per minute, which is the term of very rapid respiratory rate is tachypnea. His blood saturation was 69, normal is in the 90s. And this is a chest x-ray showing almost complete loss of lung tissue on the right side of his chest. So why is his oxygen saturation so low? And notice that you can live with only one lung and have normal oxygen levels. Is it that his blood is not receiving oxygen from the bad lung? Is deoxygenated blood mixing with oxygenated blood, or both? And the answer, both. And this is called shunting, where blood is going past bad lungs and not getting oxygenated. And that is mixing with oxygenated blood from another alveoli that is receiving oxygen, and that's called shunting. So that blood returning back to the heart is not fully oxygenated. So this is the little boy's CT scan. So this is like an axial cut. Pretend you're looking at, his feet are coming towards you, and his bad lung on this side is completely black, showing no lung tissue. So this is very poorly, like essentially no alveoli on this side of his chest. So this is the operating room. And so now we're in the operating room. And remember that he has what we call shunting or ventilation perfusion mismatching. And this is looking at how the heart is getting all this blood supply, but it's going to both sides of his chest, both lungs, where only one lung is giving him oxygenation. So the very, very first thing that happened, his oxygen was very low. And the first thing the surgeons did is tied off the blood supply going to the bad lung. So it stopped the shunting. And that gave him time to remove the bad lung along with the vascular supply to that lung. And this is in the recovery room. In order to be able to get him to be able to breathe without being on a ventilator, we placed an epidural catheter for a day, and with oxygen, supplemental oxygen, he could get his oxygen saturation up to 90% immediately after surgery. And as he was starting to wake up and expanding his good lung, he'd be able to live without oxygen. So in summary, we talked about the treatment of coronary artery disease and about pulmonary circulation. With coronary disease, the main thing is getting that blood pressure under control. Also, patients that have proven coronary artery disease are on maybe on antiplatelet medications, which include low-dose aspirin. If they have stents, they may be on blood thinners. And then they also have nitrates, which is nitroglycerin, for periods where they might have angina, so they can dilate their arteries. And the surgical approach is either the bypass grafting or the stents that get placed in the cardiac, in the cath lab. And then, of course, the other things that would be preventative would be the managing weight to keep down inflammation, stopping smoking to prevent coronary spasm, diet changes, exercise, and stress reduction, which has a huge effect with reducing cortisol. You can also reduce inflammation in the body. In the pulmonary side, the key concepts are the arteries go away from the heart, veins are any vessel going towards the heart. So oxygenation doesn't tell you whether it's an artery or a vein. particularly in the pulmonary circulation and also when we get to the fetal circulation that's coming up. And that shunting, remember that only the alveoli allow for gas exchange. So that means the trachea, the bronchi, the bronchioles, none of those can exchange oxygen. Oxygen exchange only occurs between capillaries and the alveoli. And then if you have poorly functioning alveoli, you cause shunting. So shunting can not only happen with like these damaged lungs, but also with pneumonia. That's how pneumonia causes low oxygenation. So a burnout or even places where there's asthma, that will cause shunting as well. And that is the end of this section. Please leave comments and subscribe to the channel.